As you're migrating, there are a couple of announcements that I wanted to make early on. The first is I want to thank the CDRN leads and teams that are here today. We realize your time is extremely valuable. We've tried to make this conference helpful to you, in part because we admire the tremendous progress that's being made out there. This is really hard work to put together a CDRN, often with people that you may not know before you started to write these proposals, and now you're working closely with them and working at really Mach speed. And I just want to do a shout out and say we appreciate everything you're doing, and we're here to help, and because it is a hard job, and I hope this conference is leading the way. And I'm going to turn over to Joe, who's got some announcements he would like to make early on. Or statements, I guess.
Thanks, Eric. Yes, I just wanted to really repeat what Eric said, that we are most appreciative of the efforts that it's taken to get these CDRN proposals together. It was a tight competition, but the 11 awardees, I mean, we were going to fund 8, and we funded 11 because there was so much creativity in these partnerships. We heard about communities coming together who had never talked to each other before. But we know, as Eric said, that the hard work is just beginning, and PCORI gets a lot of credit for PCORnet, but you, the PIs and the systems leaders that work with each PI probably don't get nearly the credit that you deserve from us or others, so thank you. The other thing, having an evening and a night to think about what transpired yesterday, as exciting as it was, one message just came out extraordinarily clearly, and that is that if there's any reason, and Mary Brainerd said it best, if there's any reason for a healthcare system to think at the end of 18 months that PCORnet should survive, or that it should become a entity within the healthcare system or network that gets some support, it has to be because it's proven by that time useful. So we came away from the meeting thinking that we've got to consider exactly how PCORnet, even in the early going, could produce a proof of concept that looks useful to you, the system leader. So in ways that puts another ask on you, which is to work with us enough to really let us know what could be helpful. I also want to say that infrastructure support, and I imagine your PIs have passed this on to you, but PCORI will still be there after this initial 18-month period. PCORI will still be there. We understand that infrastructure support will be needed in an ongoing way. It cannot be as much as this initial bolus, and that's what the discussion about sustainability is about. But we will be there, and I think history shows also that when a system has made a certain investment in infrastructure, in data infrastructure, networking, engagement with patients and leaders, that leads to other support. So it may lead to support from PCORI, it may lead to support from ARC, it may lead to support from NIH. Many of these sites have examples of leveraging their own investments to get external funding to do work that is highly relevant. So we only want work to be done that's considered highly relevant, but that support of infrastructure and that participation by the systems is a lever for loosening other money, federal money, PCORI money, because people in DC see this vision, and it involves you, and it involves systems using research to improve care. So with that, I'll just say one last time, we really appreciate your efforts, and mostly we appreciate your being here for this day and a half. Thanks.
That's a great lead-in for what I want to say, which is there's another group that's really made this possible, and that's the IOM staff. And since I know people tend to drift away as the last day of a meeting goes on, I want to thank Claudia Grossman, Liz Johnson, Kate Burns, and Sophie Yang for doing a fabulous job. I just have learned so much, and everything has gone so smoothly. So let's give them a thank you. So we have essentially 3 sessions today, and the idea here is, as it was yesterday, to identify the flashpoints, if you will, where the learning healthcare system needs to move through to achieve its aim and its vision, its aspiration. And one of the key flashpoints, I think, and it came up a couple times yesterday, is this idea of fostering the well-prepared stakeholder culture. Gene Slutsky is going to lead this panel where we have short presentations and discussion, and I think that this should be a very interesting panel. So Gene, there you are. I'm going to turn it over to you. Gene is the Chief Engagement and Dissemination Officer, Patient-Centered Outcomes Research Institute. She's known to many of us for the years she's been in health services research and elsewhere, and now she's trying to find her way through the maze up to the front microphone. And thanks, Gene. And the floor is yours if you can ever get up to the podium. Nice to see you this morning.